Hello, my name is Joseph Gerbel. I'm an Indiana State University baccalaureate nursing student. For community health nursing, I've created this short presentation to give information regarding anxiety. Learning objectives will be describe anxiety, distinguish between levels of anxiety, identify defense mechanisms, identify anxiety disorders, discover causes and risk factors, recognize standard treatment for anxiety. We'll begin with a pretest. We'll move on to what is anxiety, levels of anxiety, defense mechanisms, anxiety disorders, causes and risk factors, treatment, additional tips, and a post-test to see what information you've learned. At this point, I would like you to pause so that you can test your knowledge. Please follow the link included, which will lead you to a short pretest. What is anxiety? Anxiety is described as an emotion which somebody feels apprehensive, uneasy, or feelings of dread. These feelings stemmed from both real and imagined dangers can bring on anxiety. Not all anxiety is unhealthy. Normal levels of anxiety help motivate and to perform tasks or reach goals. If severe enough, anxiety can interfere with a person's ability to manage their daily lives. Based on Hildegard Peplau's anxiety model, which categorized anxiety ranging from mild, moderate, severe, and panic. Mild anxiety is day-to-day anxiety, which helps promote task completion and problem solving. It increases awareness and focus. Moderate anxiety decreases overall attention and ability to process information from multiple stimuli. People begin to focus in on a thought or observation. Heart and respiratory rate increases. Both moderate and mild anxiety have positives, which help protect and bring attention to dangers around. Severe anxiety greatly reduces the ability to perceive surroundings, usually only able to focus on a single detail or scattered throughout many details. Learning and problem solving becomes mostly impossible. Hyperventilation and feeling of imminent death is often reported. During the panic state, a patient is unable to process external information. Hallucinations are not uncommon. People are more impulsive and erratic during these panic states. Your body has built-in defense mechanisms, which defend against many outside invaders. This is also true to internal feelings of anxiety. Defense mechanisms include coping styles, which may vary from person to person. Effective and adaptive defense mechanisms will help in lowering anxiety levels. Ineffective defense mechanisms are unable to lower anxiety levels and at times increase levels of anxiety. If unable to form effective defense mechanisms, this can lead to chronic anxiety and difficulty coping with stressors. There are a number of disorders related to anxiety. I have added a short list here. Separation anxiety disorder, which is the fear that any separation will result in permanent loss and separation. Panic disorder is frequent and sudden feelings of fear and impending death, unable to function, usually physical symptoms are involved. Agoraphobia, fear of being trapped where escape is difficult or impossible. Daily functioning is often disrupted. Specific phobia, irrational fear of an object, situation, or activity causes high anxiety and avoidance. This can lead to a restricted daily living. Social anxiety disorder, fear of performing or being in public where people may judge, generalized anxiety disorder, more than normal amount of worrying about a number of different things or situations. Usually people believe the worst is about to happen. Obsessive compulsive disorder, also linked to anxiety, can be mild to severe, obsessing about routine tasks. A number of other disorders are related to anxiety disorders by raising the anxiety level without proper coping mechanisms. There's many causations to anxiety, both known and unknown. I've included a short list of causes and risk factors. Mental illness, neurological disorders, metabolic problems, heart disease, diabetes, thyroid problems, respiratory disorders, drug misuse or withdrawal, withdrawal from alcohol, benzodiazepines or other medications, chronic pain, and tumors. Trauma is a risk factor that can bring on anxiety due to pain, stress from illnesses, chronic stress, personality, depression, genetics, alcohol and drug use. Again, this is just a short look at some of the causes and risk factors, though there are many more that are known and both unknown. Treatment is very individualized when it comes to anxiety. Counseling is a form of treatment. Psychiatric health can help reduce anxiety and work on communication skills. Promoting self-help and care activities, which is encouragement to go out and do things that can calm and restore individuals. Everybody's different, so this must be highly individualized. Encouraging and facilitating a healthy sleep cycle, personal hygiene and grooming, nutrition and fluid intake. Pharmacological interventions such as antidepressants, anti-anxiety, and other classes of medications such as beta blockers, antihistamines, and anticonvulsants have also shown to be effective. Treating the causative disease or disorder that's bringing on anxiety will also help reduce anxious symptoms. Psychobiological interventions such as integrative therapy, which is therapies to help cope with stress, often include herbal and dietary supplements. Health teaching, advanced practice such as cognitive therapy, behavioral therapy, and cognitive behavioral therapy have also been effective in treating anxiety symptoms. Additional tips to help reduce anxiety. Knowledge about the individual disorder that's causing anxiety helps people understand the reasons and treatments for their disorder, with a goal to lead to a self-actualization and inner power to control anxious thoughts. Support groups to help relate feelings and assist with finding coping strategies. Do not isolate. Journal what causes and reduces anxiety levels. And again, anxiety reducing treatment is very individualized. A person must test what stress reducing techniques work for them. At this time, I would like you to pause this presentation and take a short post-test. This is meant to test your knowledge with the information gained from this presentation.